and we're going to get started here.
That's me.
You wouldn't mind turning off your cell phones? That'd be great.
Yeah.
And the panel is all here. So thank you for being here. And to introduce everyone is Nancy Davis, our founder.
Hi, everybody. Welcome. We're so happy you came out on a Sunday to hear some wonderful news about MS. This is the most stellar team of doctors from all over the country who are researching very hard and coming up with really amazing things. What's exciting about MS, no matter how you look at any other disease, is it is on such a fast pace. There's so much happening. There's so many new findings and drugs about to get approved. And I know so many years ago when we started this some 20 years ago, there was nothing and not a whole lot of hope. What's exciting today is MS is now popular. Popular meaning, not you want to have a popular disease, but popular meaning there's so much hope because people are excited, they're researching, they're investing in this, and it's because they really feel that we are going to find a cure and find out how to help many different types of MS live a much better quality of life. So very excited. We do the Race to Race MS every year. This year it will be coming up April 15th, so please mark that on your calendars and come. Tax Day, which I don't know if that's good or bad, but we're really excited, and by then I think some more exciting things will be happening. This wonderful group came in, and I think they should tell you what's going on because they know everything. So please take it away.
Okay, I'm going to ask each doctor to introduce themselves and tell a little bit about what they're doing, and then we'll go on with the program. So, Dr. Wabant, may I start with you?
Very nice to see a group that's growing from year to year because I think there's really a lot you can learn in these programs, and thanks to Nancy, we're here to answer all your questions until they're exhausted. And we are exhausted. So I am a neurologist working at UC San Francisco. I work with adult patients with MS, but also with pediatric patients who have MS. So I see both the whole spectrum of ages affected by the disease. I do clinical research, so I look at risk factors for the disease, and I do clinical trials.
I'm David Hafler. As I was saying earlier, I'm an immunologist. MS is an immunologic autoimmune disease. I've deeply studied the immunology of the disease and the genetic cause of the disease. I'm also a clinical neurologist, and I chair the Department of Neurology at Yale.
And he's a brand new grandfather.
And I'm a grandfather. And come by later, I'll show you pictures.
Hi, I'm Peter Calabrese. I'm a neurologist. I direct the MS Center at Johns Hopkins University in Baltimore, Maryland. And we have a large center that works on many aspects of MS, but our focus right now is on progressive MS. As you know, we have more and more therapies that predominantly target relapsing MS, and so we're trying to unravel some of the mechanisms that might be slightly different in progressive MS so that we could design treatments that may work, and we're also trying to develop outcome measures that might be more sensitive to some of the changes that happen in progressive MS so that we can test those treatments more quickly and hopefully get some approved.
How's everybody doing? Good. Good afternoon. My name is Dr. David Osman. I study the correlation between music and health and wellness and the body, the mind, the soul. I am the kid who's not like the others up here, as you can tell. I don't wear a white coat. But I am here, just like many of you, to see where we are. And I tend to disagree with Nancy. It is a popular thing. All the cool kids are here. And I've always heard a saying that if you're the smartest person in the room, you're in the wrong room. And I know for a fact I'm in the right room today because of this table of physicians and doctors. And I'm really excited to hear the updates. It's fascinating to me how year in and year out now in the world of MS, we're getting so much more information than we ever have, and it's snowballing. And I know that there has been more happening in the world of MS in the last 5 years alone, let alone the last 100. It's really grown. And my dad has primary progressive for almost 30 years. So I grew up around this world knowing what MS was until I really knew what it was about when I myself was diagnosed about 10 years ago with my own physical challenges. But I'm out of my wheelchair and I'm walking today. And you talk about hope, Nancy, and there certainly is a lot of hope to be had for a lot of people. And we're hanging on to it. But it's real, and some cool things are happening. So I'm just here to support this great foundation, to bring a little bit of music occasionally, and to learn with the rest of all of you. And it's pretty exciting to be here. So thank you for having me.
This is so hard to follow that. I'm just a doctor. I'm just Dan Peltier. I'm from USC. I'm a clinician. I'm a neurologist. I've been at USC for 6 months. I'm the new head of the MS program at USC. I was at Yale for 5 years before that, and at UCSF for 12 years prior to that. I like to say that I work for the Race to Erase MS University. I go from one site, one center to another.
What's the next site, Daniel? What's your next site?
Well, hopefully this is going to be the last one. Hopefully this is going to be the last one because we are going to find a cure for MS, and then we're going to transition and do something else than MS.
I like that. I like that.
Amen.
Hello everyone, I am Vijayashree Yadav, one of the neurologists working at the University at Oregon Health and Science. And I'm the clinical director of the MS Center up there. I work with Dr. Dennis Baudet, who has been coming here for a number of years and working with Nancy and her foundation for almost 20 years, I think. So it's been my honor to be able to present here our work, our center. In terms of our own work, so I'm personally interested in doing things beyond just the disease-modifying therapy. So, for example, complementary therapies in MS that people really like or they have a lot of interest in. We have been trying to explore the scientific evidence behind that. So, for example, diet is a very popular intervention that many of our people are interested in, and so we have been trying to explore if there's what kind of diet could be helpful and in what ways. And also, we recently finished a one-year study of a diet intervention, a plant-based diet intervention in MS, and so that the data has been kind of analyzed, and we are trying to publish the paper right now. I also have worked on a supplement called, which is an antioxidant supplement called lipoic acid, and trying to find whether there could be a role of such antioxidants in MS. Recently, we've been awarded by the National MS Society for developing a wellness center at OHSU. So that's another big theme among I guess, patients that they really want to do something beyond the disease-modifying therapy or the drugs that we prescribe as neurologists to them. So that's something big at our center that we really strongly believe in, and we would continue to work in that direction.
Thank you. I'm Claudia Curry-Hill. I'm on the board for the Nancy Davis Foundation for MS, or the Race to Erase MS. And I was diagnosed with MS along with David's father 30 years ago. So one of the things we're going to do today, there's a questionnaire in front of you. Look, if you have any questions for the panel, I would ask that you fill out your question on that piece of paper, and someone will come along and collect them and bring them to me.